Now, the Ministry of Health has this morning flagged off health, water, sanitation and hygiene supplies for emergency response to various parts of the country. Increased incidences of cholera, now recorded in 6 counties, have rendered more than 600,000 children with severe malnutrition across 23 counties. The Ministry of Health says 78 people in 14 counties have died of cholera-related complications since October 8th last year. Addressing the press on Tuesday, Health CS Susan Nakumicha said that the Ministry of Health will work tirelessly with their partners in the drought mitigation. Dolly Mwirigi now reports.
Cholera outbreak has so far affected several counties since last year, when the first case was reported, has claimed 78 lives. According to the Ministry of Health, the drought in Kenya has increased incidence of cholera and rendered more than 600,000 children with severe malnutrition across 23 counties. Speaking during a press conference on Tuesday, during the flagging off of health, water, sanitation and hygiene supplies for emergency response, Health Cabinet Secretary Susan Nakumicha stated that 4,186 people have been hospitalized since the outbreak of cholera in October last year. Cholera transmission has been linked to inadequate access to clean water and sanitation facilities in the affected counties, and especially in the slums and camps for internally displaced persons or refugees, where minimum requirements for clean water and sanitation are not adequate.
The total number of counties affected has been 14. 5 counties have managed to be able to bring the outbreak to total control. But we still have 9 counties which have active cases of cholera. If we continue together with our partners, that in the not distant future we shall be able to bring this outbreak to an end.
According to the Ministry of Health, the county has developed a national multi-sectoral cholera elimination plan, which has prioritized identified hotspots based on sanitation and hygiene wash indicators.
These items would go a long way in supporting the crisis at hand, which is to do with the cholera outbreak, but also more importantly to the current drought response in Asal counties, but more likely to also ensure that how we have a preparedness angle in non-Asal counties, and more so about the Ebola and the cholera preparedness.
As we flag off this morning is just to say thank you very much, and to know that we are here to continue working together so that we provide resilient systems to be able to counter each and every pandemic that comes our way. I'm happy also to hear from UNICEF that in the next 1 week or so we shall be receiving the cholera vaccine.
The CS indicated that to successfully implement the plan, strong partnership are required to mobilize and deploy necessary resources. Dolly Mwirigi for Hope TV.